Hi, you guys. Hello. Sorry, my hair is a mess. It's kind of early, but I'm gonna be doing a face mask, the one I got from my Ipsy bag yesterday, and also talking about my surgery a little bit. This is Maddie's shirt. I've been staying in Maddie's clothes. Also, I'm about to use his, my boyfriend's face wipes so I can just make sure my face is extra clean before I put on this mask. But I want to talk a little bit about my tubal pregnancy and my surgery following with that. Before my surgery, well, I guess let me not skip ahead. I found out I was pregnant around like 6 weeks, and everything seemed normal. We were super excited. We wanted, we've been trying, and I started having a lot of cramping. Like the cramping was, I thought was normal at first for like the first couple, but it was pretty consistent, like every other day. And by the fourth day, I kind of thought something was up. But the doctor said as long as it wasn't anything sharp, just to leave it and it should be fine. And then the next morning after I called my doctor, I did have a really sharp pain on my right side, and it was like definitely different, something I can't really explain. It was like sharp and stabbing, like almost like a stretching feeling too. And so she had me come in immediately, and they tried to find me like the next appointment. My doctor didn't have one, so they had a doctor in the same office like check me out. And once uh, he was like doing the ultrasound, he's like, yeah, I don't see anything in the uterus. And at that point, I already knew something was wrong. I started like bawling because I was like 6.5, almost 7 weeks by then. And there definitely should have been at least a sac or something in there. And Maddie was at work, so I called him bawling, and he was really upset too because we were really excited about that baby. But the next day I came in, well, that same day I had to get my levels took, so I had to get a blood draw to see to check my levels because we were gonna get a shot called methotrexate to keep the baby from developing and popping my tube so I won't eternally bleed to death. And that was really hard for me. I didn't really want to do that because I was so excited, but it was either me or the baby type thing. And so that was really crazy. And I got my first shot of methotrexate on that Thursday. I can't remember the dates, but it wasn't that long ago, maybe like a week or two ago. And I was doing okay. I had one day of really bad cramping, like 2 days after, like 3 days after, which they said that would be normal. Well, I need a lot more than this. Sorry guys, I'm getting distracted. This one looks a little creamier than I thought it would be, but okay. We're gonna do a face mask as well, so. But that was, and then I like thought nothing of it. I thought it was just the methotrexate working, so I just continued without my day. And then because methotrexate I guess can cause like mild cramping, it's actually used also as chemo. It keeps your cells from redividing, which is why I needed it to keep the baby from going and bursting my tube. That I actually lost anyways, but we'll get to that. So then about 2 or 3 days after the mild cramping, I had like severe cramp. I was talking to my customer at work about having a tubal pregnancy and the fact that I was going through it. And she asked me if it hurt, and I was like, it's just not too bad. It comes and it goes. Literally right after I said that, the pain was so bad. She had a call over I was like rocking in pain, and she had to go find my coworker and tell him to come up and save me because like I almost hit the floor. Literally, it was like the worst pain. Almost I can describe it as like labor. Labor is like the next best way I can describe that. Like that's how bad it was, and I already knew something was wrong. And my coworker wanted to call the EMTs, but I was like, no, call Maddie. I'm calling Maddie. Like he's gonna come get me. I did not want to go in an ambulance, even though when I got to the ER, Maddie got there, and he took me to the ER. By the time I got to the ER, I was crying, like I was screaming in pain, and Maddie couldn't come back with me. He asked, and we were both really upset about that because it was scary being alone. But because of COVID, nobody's allowed back into the rooms with you guys, with anybody. He wasn't even allowed in the waiting room. And good morning. Give me 1 minute. I'm almost done, okay? Ava just hook up. But then once I got in the hospital, they saw how much pain I was in, and I was already in a room, like a rapid response room, within 10 minutes of checking in. That's how extreme it was. And they already knew it was a tubal, and tubal is really life threatening. So yeah, we did that. We got to the room. I got into the room. They did like 2 ultrasounds and blood work within 15 minutes of me being there, and they have confirmed that the ectopic was in fact getting bigger, and he wasn't. He was growing more. I keep saying he. That's what I wanted it to be, but the baby was growing more, and so they they said the best thing we could do right now, because the methotrexate, which was the shot, isn't working, is we're gonna have to go in there and just try to get the baby out of the. If it's already cracked, we could slip it out. If not, we'll either have to cut the tube or take the ovary. But luckily, they just cut the tube.
Why you
Yes.
your baby out?
Because I had to, baby, because it was hurting me. Ava was really sensitive about the topic too. She really wanted to be a big sister, so that's why she's upset right now that I'm talking about it. She was asleep until right now, but so yeah, that was the day they took me in, and I had like 3 pretty good sized incisions where they took out my right tube. And I didn't know they even took out. Like when I woke up, I was like, "Is my ovary still in there? Like, what did you have to take? Is the tube gone? Like, what happened? Did you get the baby out all right?" And nobody knew. Everyone's like, "You could call your doctor tomorrow, and they'll let you know what's going on." We have no idea. I'm like, "So nobody knows like what you took out of my body right now?" So that was a really weird experience, and definitely a hard one, since now I have 50% chance, like harder to get pregnant. My sister went through the same thing though, and she's pregnant, so I'm hoping for the best. Maybe, I don't know. We'll see how it goes. Gonna give it a couple months. Maybe try again. We'll see. I really like this clay mask though. It's actually kind of minty, which is really weird. I don't know if you guys can see it, but yeah. So I'm on day like 4, or yeah, 4 of recovery, maybe 5. I don't know. And so that's about it. That's my story, I guess. So just be careful, guys. Anything can happen, I guess. And that's it.